The shoulder area and the upper back area are places where there should be a lot of mobility, a lot of ability to move around, even in the spine. Yet, if you've ever had massage, you know this area can become a mess of painful knots, even to the point where it starts restricting the mobility in the shoulder, both the back and the front, and even in the upper spine. Luckily, there's a lot we can do about this and restore some of the function, both the mobility and also ease and efficiency of breathing, which can be affected. The ideal is to go to a skilled manual therapist. As a supplement to that, or if that's not available to you, there's something you can do quite easily to make a big difference. All you'll need is a clear wall space and a ball, something the size of a tennis ball, or it can be slightly smaller or slightly larger. Preferably something with a little bit of grip that's not entirely solid, something that has a little bit of give. I quite like using this rubber ball. I think it gives a little bit more grip and is a little bit firmer than a tennis ball. All you need to do is place your ball of choice against an area of wall. Then place your shoulder on the ball and start moving around and hunting for those sore spots, for those knotty areas. You'll know when you found one, stay on it, apply pressure until that pain eases off somewhat. Then apply a little bit more pressure. You could do that for up to half a minute. It's probably best not to go for too long and rather do this frequently, maybe on a daily basis until you're really making a key difference. To get into some of the areas such as in the side and a little bit underneath the shoulder blade, just bring your arm across. Then find those spots, stay on them until you get some release. To really work in another area that tends to get quite tight, especially here, the lat muscle or the latissimus dorsi muscle, just raise the arm overhead, find those spots, really work in there. By shifting your feet, you can apply different amounts of pressure. Start lightly and then work your way in. It might take you 3, 4, 5 minutes aside to begin with. Do it on a regular basis and you'll release more and more of those knots, and then it becomes a quicker job just to give yourself some maintenance. There are a few caveats. Avoid any areas where you currently have an acute injury, whether that's to the skin or whether it's deeper in the muscle or toward the bone. Also, if you have any area where you have reduced sensation, such as from peripheral neuropathy, avoid those areas or at least seek some professional advice whether it's okay to work those areas. Be very careful and check on them afterwards just to see if there has been any damage. If you do find, for anyone this is, any bruising, let it heal and then be gentler the next time round. Most of you will find that you can get in there quite firmly even though it is quite sore.